Well, hi everybody. Today I want to talk about something important. It's how to take a lung biopsy. As we say, or as I speak to you in the last video about the interstitial lung disease, that we are dealing with some sort of diseases which called the interstitial lung disease. The diagnosis is dependent in more than 90% by taking a biopsy. So we need to have a biopsy from the lung. We got really three main methods to get a biopsy from the lung. First, transbronchial biopsy, which is done under local anesthesia by the fiber optic bronchoscope. We insert the forceps through the instrumentation channel to take a biopsy. Usually this is a safe procedure, but the problem it is very small, very tiny pieces. Usually it's not yielding. It's produced that the pathologist cannot tell about the details of the disease that we needed, especially in some complicated disease. The other way is the surgical lung biopsy. It is a very big biopsy, very yielding. The pathologist usually feel himself very comfortable to say the diagnosis, but the problem is extensive surgery. It needs opening of the chest. It needs a chest tube for around 1 week. It's sometimes complicated by what we call persistent air leak. There is a lot of surgical complications, just infection, bleeding, etc. So it's an extensive surgery with high risk of complication, but a very yielding. But the third one, it's the best one to me. It is the in-between. It is what we call it a cryo-lung biopsy or cryotechnology, which is done under local anesthesia by intubation, by rigid bronchoscopy. Then we pass in the fiber optic and we insert some sort of machine or needle, what's called probe, through the instrumentation channel of the fiber optic. We freeze a part of the lung and we get it out. It's a safer procedure. The only complication there is some chance of pneumothorax. If it's happen, we can put it, by pneumothorax, it's a collection of air inside the chest cavity or inside the chest cavity, yes. If it's occur, we can put a chest tube to drain this air just for 2 to 3 days. Nothing long term, nothing future complication. Usually the patient discharged on the same day with a good result. Usually we get 1 or 1.5 cm piece, which is very good for the pathologist. They can give a diagnosis with 100% confidence. So very good new technology, and usually I practiced in the last 2 years, produce a very good results. So I really like this procedure and this technology, and in the next video I will try to show you the machine and how can we do this procedure. And thank you very much.